Now I'd like to welcome our first guest on the program, who's a sponsor and good customer of ours at the IHC, Renee Lutzen, Senior Director of Healthcare at Visa. Renee, good morning.
Hi, good morning. How are you doing?
We're doing great. How are you?
Good, fine, thank you, and thank you for having me on this morning. I appreciate it.
Yeah, it's good to have you here. Everyone knows Visa, Renee, but give the audience kind of an update on Visa and their healthcare footprint and your role at Visa, if you would, please.
Sure, absolutely. Thank you. As the Director of Prepaid Employee Benefit Products, my role really is to focus on enabling and supporting and delivering payment solutions for all of the stakeholders in the healthcare industry, really including the consumers, providers, as well as payers. As one of the largest payment networks in the world, Visa has been moving, healthcare-related payments for decades, for virtually decades. But more than 10 years ago, we intentionally focused on healthcare as a vertical, and within this vertical, delivered payment solutions really that are focusing on four main areas: the corporate payments and insurance reimbursements, which are products like standalone wellness and incentive cards, drug sample or copay assistance solutions, and flu cards. We're also engaged in the payer-to-provider payments, which using like the Visa Payables platform, for example, for virtual single-use accounts, or straight-through processing, which is similar to an ACH-type payment. Visa has also been involved in the hospital procurement payment solutions. That's, payments kind of between healthcare providers and suppliers, such as healthcare device manufacturers, wholesalers, and distributors. And then finally, the employee benefit and consumer payment space, which includes acceptance at payers for individual premium payments. For example, if an individual wants to make payments on the federally facilitated or state exchanges, as well as online payment portals to help providers collect post-service payments. And then finally, the products that we're probably all most familiar with, the flexible spending account, health reimbursement arrangement, and health savings account type products. And then we also are, because we recognize that this is a highly regulated, very complex industry, we also engage with industry organizations such as the Employers Council for Flexible Compensation, HSA Council, and CGIS. And these are organizations that are involved from both an advocacy as well as a technical aspect. So we're pretty fully engaged in the healthcare space.
Yeah, and you've been very involved, as you said, with ECFC and HSA Council, and kind of one of the outcomes from particularly ECFC and others' lobbying efforts was this new FSA carryover option. And you just completed a survey with WageWorks that has some interesting findings. Can you talk a little bit about that, please?
Sure, absolutely. As you know, the FSAs originally, a long time ago, they allowed for pretty much an unlimited contribution with the caveat that all of the contributions had to be spent before the end of the year, or the employee would lose those funds. And then the $2,500 cap was added. It kind of was a consideration that, if we cap the contributions, then, do we really still need to maintain the use or lose aspect? And so the approach was that if you take away the ability to contribute unlimited amounts, is it really necessary to continue to have that use or lose attribute? And so we'd been doing quite a bit of advocacy on getting that revised, and then, as you know, the IRS came out with that revision in October 2013. So to offer employers the option to be able to have a $500 carryover for their employees as opposed to offering just the grace period. So we anticipated that with use or lose, it's always been the number one reason why employees do not participate in FSAs. We thought, we expected that, with this revision, we would expect to see more employers offering it to their employees, as well as more employees than participating in the FSA. So that's why we decided to go ahead and do this research, to just kind of do a a confirmation, see if we could get a validation of that expectation. So we did conduct a survey with one of our partners who has direct relationships with tens of thousands of employers, and went out to their mid-sized, large-size employers with this particular survey on this question about the FSA carryover.
Yeah, and so you found more employers participating. Is that correct? I mean, because of the carryover and more employees, using the FSAs as well.
We did. The key findings were really that, as we had expected, more employers had switched to the grace from the grace period to the carryover. And again, as I'd mentioned earlier, that IRS made the change. They introduced that option in October of 2013, which, as we all know, that's really late in the year for a lot of employers to be able to react and respond to a change like that. So we really did. We did do a survey in 2014, recognizing that with that the change had come so late in the 2013 year that we might not get a lot of valid, from a statistically significant perspective, that we might not get enough valid information. But directionally, what we did find is that almost 50% of employers had started to shift from the grace period to the carryover. Then when we did the survey again this February in 2015, we found that was 60%. That had gone up to 60% of employers had switched from the grace period to offering the carryover. So a pretty big leap in a fairly short period of time.
Yeah, it is.
One of the other. I'm sorry. Go ahead.
No, Renee, that's okay. I said that was a pretty big leap. Go ahead.
Yeah. So a very solid move by the employers. And then one of the other key findings from the employee perspective was that what they did report is that they had increased FSA enrollments. They were reporting that it had increased by 8%. And the previous year, they had said that their employee participation rates had increased 4% because of the FSA carryover. So again, another very solid finding in a year-over-year change in participation rates.
Renee, tie this together with Visa's interest and your tremendous support of FSA initiatives.
Sure. Really, Visa is about reducing friction in payments in general. That's pretty much what our focus is in the industry. So the IRS had mandated that if people wanted to be able to use cards to make their payments, that merchants would have to have this inventory information and approval system in place. So, we just really felt that it was imperative for our partners, who are benefit administrators and financial institutions and processors that facilitate these payments, that we stay engaged and help kind of set what those standards would be and guidelines. So there was an industry group that was started that had merchants as well as financial institutions and networks involved, that would enable this auto-substantiation at the point of sale. But again, our perspective is really that we want to reduce that payment friction. If consumers want to buy goods and services and merchants are trying to sell goods and services, we want to be able to provide solutions that are familiar to both the consumer and the merchant, as well as safe and convenient access to the funds. So that's really, how Visa is engaged in this whole process.
Oh, that's great. And the same really similar connection points to your support of HSAs, correct?
That's right. Yes, absolutely. Yep.
Yeah, you've got I don't want to get off of this program without, talk a little bit about it. You've got a key workshop coming up at our Foreman Expo where you're really talking about, you and your partners are talking about financial wellness, and that's really a very important new topic out there in the marketplace right now, is it not?
Yeah, it is. This perspective of financial wellness is becoming more important to employees, and they're looking to the employers for help with this. And I think consumer-directed health plans just in general, such as FSAs and HSAs, really tie into the whole this whole sense of financial wellness. And really that's why, we think that this option to offer a carryover is really a perceived value to both the employee and the employer, because if we have more people that are able to set aside funds that are specifically for their health care costs, that does provide them this sense of financial stability, if you will, or at least some additional security that if they do experience some kind of an event, that they do have money set aside that they're able to pay for it. So it's obviously beneficial for employees to participate in enroll in these products. So the option to be able to carry over up to $500 really takes a lot of the pressure off of the consumer. I think gives them more of a comfort zone and allows them to participate in this benefit with a little bit more peace of mind going into it, instead of the fear that, gosh, if I don't use all this money by the end of the year, then I'm going to just lose it all.
Yeah, I think it very well said, Renee. Listen, I really enjoyed having you on the program today. Any final thoughts you'd like to leave our audience with?
No, again, I just think that the employers should be looking at the value of the carryover, because it is something that I think does bring considerable perceived value to both the employee and the employer, whether it's from tax savings, from participation rates, and just this financial peace of mind. So glad that the IRS did make the change and that employers are making the shift over to offering it to their employees.
Yeah. Renee, that's great. Thank you so much for joining us today. You have a great weekend, and hopefully we'll see you and your team soon here at IHC Forum and Expo. And again, a reminder to the audience to attend their special workshop on financial wellness. Thanks again, Renee. I really appreciate it.
Thank you. Appreciate it.